Okay, good morning, everyone. Good tropical storm Helene morning. So excited to be together. For those of you who are able to join us, and a special thank you to those who are joining us without power on your phone. But really a special gratitude. So excited to be able to spend this time to get to meet Dagny McDonald and to learn about Sickle Cell Partners of the Carolinas. It is Sickle Cell Awareness Month, and there's so much to learn. I know there's so much I need to learn about it. Before we do, just a few quick announcements. So excited. Hopefully you are seeing the registration is live for our third annual Joining Our Voices, Envisioning the Future of Serious Illness Care virtual symposium. Our 3-day symposium is coming together so nicely. For those who haven't joined in the past, it's online, and we're doing it for 3 days from 12 to 1:30 each day. So a little lunch and learn on October 30th, October 31st, and November 1st. Hopefully you have gotten the email with the links, but you can now get it. Jessica has just been phenomenal getting it all, the promotional materials ready, and everything's up on the website so you can register very easily. Really quickly, day one is all about how we are in this together, how the caregiving crisis affects us all, and what we can do about it. So that's going to be a wonderful panel of advocates in the family caregiving, the aging, the disability space, direct care workers, family caregivers. So that should be wonderful. Day two is on Halloween, our trick or treat edition, the future of AI to improve care and caregiving. So I thought that's kind of fun, and we thought that it's kind of a neat Halloween topic. How is AI going to have an impact on all of us moving forward, and some new products that will be impacting it, and then some big picture, and AARP is going to be moderating that, and health data management will give us the view. And then, as you've been hearing about, Friday, November 1st is our My Superpower documentary. It's the documentary screening and a conversation with advocates, and the film's young star and her mom. She lives with NF1, a rare genetic disease. And so there's a 10-minute documentary that was created. We have exclusive screening, which is lovely, and then we'll have a whole conversation. So please register for those events. And now I don't want to take any more time, because I want to jump all into Dagny McDonald, the CEO, founder, chair of, I just gave you all kinds, but I know you were the co-founder and chair of Sickle Cell Partners of the Carolinas. And then you made this really interesting comment, like, I'm also in TV and broadcasting. So before we get into Sickle Cell Partners, as we always like to do with Friday Facts, this is our time to just get to know each other also, and then we want to hear clearly about the organization. But tell us about you. You're very comfortable in whatever I'm doing right now.
Well, thank you. Thank you, Heather. Thank you for inviting me to talk with your group on behalf of Sickle Cell Partners of the Carolinas. My name is Dagny McDonald, and as I threw out that little blurb to you this morning, Sickle Cell Partners is not my day job, not by any means. I am a producer for NBC News. I have worked for NBC News for 30 years. My job with NBC, I'm a regional producer for the Great Lakes region. So I handle news in Michigan, Indiana, Illinois, and Wisconsin. So I begin my day doing Teams calls with all those stations. Prior to COVID, obviously, that was conference calls on the phone. But I talk to stations, NBC stations in those states, figuring out what they have going on, what they need from each other, what the network may need from them. And I bring in video and I write stories all day long. So that's what I do.
This explains it. As our folks, and I know a lot of folks also watch the recordings, as people know, I lovingly say I stalk our guests, which is more fun, right? You're a producer. It's more fun to say I stalk you than I research. And I was so confused, because when I typed in Dagny McDonald, and then I was getting all these things about producer and Michigan, and I'm like, no, she's in the North Carolina, like she's in the Carolinas. This must be another one. Oh, that is you. Oh,
yeah, it is me. It is me. It is me. So I work for the feed service for NBC News. So literally myself and colleagues that do the same thing that I do, we bring in news from all over the world into our facility and send that out on a system to all the NBC affiliates across the country. And we support nightly news, the Today Show, and MSNBC, our cable channels, and all of that. So very.
Oh my goodness. All right. Well, then we are extra excited to meet you. And one of the things we love to do with the North Carolina Serious Illness Coalition is to make friends through this kind of format. And it's our way to learn about each other and say, well, what can we do to help promote the issues that you're working with? So clearly, what can we do to partner and talk about Sickle Cell Partners of the Carolinas? But now I'm all thinking all selfishly, like, oh, no, 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 no. What can you do?
Exactly, to shed light on what you're doing.
Like,
Absolutely.
how can we help to promote issues? So we have a lot. So please participate in the virtual symposium.
I will.
So many issues about caregivers and both the direct care workers, family caregivers, and here at the Serious Illness Coalition, we look at a range of serious illnesses and across the lifespan. Many of us come from the aging space, and there's a big aging related meeting this morning. And my colleagues that are on from Novant, we do a lot around education, around advanced care planning and serious illness conversations. But we also have a whole group, and we had a meeting about those with more pediatric illnesses, caregiving for medically fragile and complex children. So, oh my God, this is already.
We have to continue the conversation, right?
I know. Tell us, since it is Sickle Cell Awareness Month, and we have a wonderful communications and advocacy work group, and they brought up, they're like, it's Sickle Cell Awareness Month. We need to become aware. So while I so want to do nothing, and we're going to have you come back. We do part 2 sometimes and learn all about your role as a producer, how you promote roles. But give us a little bit of education. What is sickle cell disease? Sometimes I see sickle cell anemia, so I'm going to stop talking.
Exactly.
Tell us about the disease and about your advocacy and support work.
Okay, so Sickle Cell Partners of the Carolinas was formed in 2009. My husband and I have a son who was born with this condition. We also have an older son who has the trait. When our son Jensen was born in 2005, I was literally scared to death. I literally was scared to death. I went to the doctor for a regular checkup. I was told your blood pressure is a little high. I can give you something for that. And by the way, you have the trait for sickle cell disease. Never really heard of it, did not know. This was 2005. Fast forward to the birth of our son, Jensen, April 9th, 2005. And I remember a nurse saying, oh, we think we broke his collarbone when he came out. And I thought to myself, because by then I had done some research on sickle cell, if that's the worst thing that can happen, we can fix that right now and be done with it and not have to worry about anything. Unfortunately, that was not the case. I got the standard letter in the mail from the North Carolina Department of Health saying that my child had sickle cell disease and I needed to call this agency and check in with my doctor. Just, when I look back on it, a very sterile, a very uncaring, just way to alert you that your child has a life-threatening illness. So 2009, I'm going to fast forward a few years, out of my frustrations and other parents that I met trying to find care for my son, a group of parents came together that wanted to just talk about this illness, talk about their experiences. We were fortunate enough, the clinic that we were going to at Atrium Health, there was a nurse there that lived with sickle cell disease, and it was just very enlightening to see someone older that had this, because parents at that time and still now are being told that, your child may not live beyond a certain age. This is very serious. They're prone to all sorts of pain crisis, infections, different things. So I'm going to go through the slideshow. And as I do that, we'll just talk a little bit about Sickle Cell Partners and our experience. So our mission to provide a network of support for patients and families affected by sickle cell disease, to raise awareness and educate the community, and to advocate for a cure. I will say this, our son is now 19 years old. He had a bone marrow transplant in 2018, and he is a sophomore on the campus of the University of North Carolina at Asheville. And when my son came into this world, I could have never imagined him on a college campus, walking around free for the most part of the ups and downs of this condition. Sickle cell disease is very hard to live with. I have found through my work in the sickle cell community, a lot of people don't want to talk about this disease because they don't know what it is. They don't understand. So we will get into that. Let's see if I could advance the next slide.
Yes, and I just want to take a moment to say, I'm so happy to hear that. And I have friends with their children at UNC Asheville. They are currently under a lot.
They are.
Um,
They are.
Again, so much to talk about for those who don't know, because of Tropical Storm Helene's path, UNC Asheville shut down and told the kids to leave, and a whole bunch of kids, including, are like, but we're here.
Exactly.
We'll talk about that after, but
Exactly.
I'm happy he's having a college experience, and he's really having a college.
Yes, he is really having a college experience. He really is. He really is. So
All right.
sickle cell disease is inherited. So ever since I've known about this condition, the estimate has always been around 100,000 people. I don't think they really know, but that's the going estimate. While this condition primarily affects African Americans, it includes a wide array of populations: Hispanic, Caucasians. I know people, Heather, that look just like you that live with sickle cell disease. People of all racial and ethnic backgrounds are affected by this condition. I will go back and say the reason why they say that it's primarily affected by African Americans is because of a gene mutation many years ago. We have known about sickle cell disease for about 100 years, just a little over 100 years, but this traces back actually to Africa, where people that lived in that region are affected by malaria from mosquitoes, which is a very serious condition itself. There was a gene mutation that happened over time that is believed to protect people from malaria. But because of that gene mutation, we have what we call sickle cell disease, the sickling of the blood cells. So if you look at the slides, we all know our red blood cells are nice and round. They move through our body without a problem at all. When you have sickle cell disease, they literally take on that sickle shape, the shape of a sickle, the shape of a banana, and it makes it hard to move through one's body. So those cells that are sickle shaped, deformed cells move through the body, can get clogged anywhere, in your arms, in your legs, in your back, in your stomach. And that is what causes the pain. You'll hear about people that say that they have a pain crisis due to sickle cell disease. That is because those red blood cells are not able to go through your body as they should. So this second slide here shows when they get clogged, they just cause that pain. When you suffer a pain crisis, when my son was born and still today, the only way to relieve that, we tell people to hydrate, hydrate, hydrate. Hospitalization is what people have to do to get those IV fluids moving through, to get that pain medication on board, and it pushes all of those, for lack of a better word, bad cells through. A crisis can happen at any time. With our son, it could be cold, crisis. It could be hot, crisis. It could be a beautiful day, crisis. You never know what brings on a pain crisis. People are stressed. People don't hydrate. Maybe you have a cold. Your immune system is not where it needs to be. You never know when you'll go into a pain crisis. So, you know, living with sickle cell disease is sort of living uncertain, because you plan for the best, you plan for the best, and you never know when your body is not with that plan. So through the years with our son Jensen, we have gone on vacation, literally ruined because of pain crisis. People you go to work with the best intentions, not feeling well, weather like this, in the fall, when it gets, the weather starts changing a little bit, you just never know what your triggers are. So, I will say the most important thing about sickle cell disease is knowing your trait status, okay? Because this is hereditary. So sickle cell trait is a whole lot different from sickle cell disease. Sickle cell trait means that you have the trait that can cause you to have this disease. So it's inherited just like your eye color, just like the color of your hair. This is not something you can catch.
Mhm.
Not something that you can catch. It's hereditary. So to break
Oh,
it
good.
down,
I was going to ask about do both parents have to have it? Because I know
exactly,
your other son has the trait, and so now
exactly,
we're getting into interesting future
exactly,
conversations. All right, sorry,
exactly.
all right, taking it in. This is
Okay,
breaking
so
and helpful. Mhm.
here are the things that people need to know. It is so important that you know if you have the sickle cell trait. A simple blood test by your doctor can determine that. So you have two people that come together. Both of them have the trait. So with each pregnancy, and this is important for each pregnancy, for two people that come together that have a child that have sickle cell trait, there is a 25% that your child can have sickle cell disease. There is a 50% chance that your child will just have sickle cell trait. And in that remaining 25% chance, your child will not have the condition or the trait. So it's the genes that you pass to your children. One comes from mom, one comes from dad. You can have 4 children. All 4 could have sickle cell disease. It's the roll of the dice each time. You can have 2 that have the sickle cell trait. You can have 1 that has the disease and 1 that has nothing. So whenever we have young people who are dating, like my husband and I were, for us, it wouldn't make a difference. But education is key. It is very important if people know that they have the trait. I have done health fairs, different events, and some people have no idea. But the impact, oh my gosh, the impact. So this sort of illustrates mom and dad here with both having the trait. The blue denotes that, okay, that's the trait that they're passing on to their child. And so this just illustrates sort of that 1 in 4 chance that, you could have nothing. You could have the trait. You could have sickle cell disease. It's all about the science. It really boils down to that 8th grade biology class when you're doing AA,
Yes,
AS.
the big A, little A.
Exactly,
You
exactly,
and
exactly.
you and
That
your husband didn't know. I know I'm Jewish. I come from the Jewish background, and so when two I did not marry a Jewish person, but when two Jews get married, they part of the process is you get Tay-Sachs, you get tested for Tay-Sachs, and then
mhm,
this is making me think we have someone who wanted to come on the show, which we'll have talking all about genetic conversations, a
mhm, mhm.
physician and psychologist that focus on genetic counseling. But you all didn't know.
Exactly, we didn't. And you know what? I use that as an example all of the time with Tay-Sachs, because in the Jewish community, that was so devastating for families until they stepped in and said, stop. No, we are not going to do this. Unfortunately, the sickle cell community and people affected by this condition aren't there yet. But it just goes to show how important it is knowing about your genetic makeup. And people always say to me, oh, well, I don't want people in my business. Or a grandmother will say, oh, he has that bad blood. Oh, he has sugar. No, he doesn't have sugar. He has diabetes. No, he doesn't have bad blood. He has sickle cell disease. Let's talk about this in a way so that people understand their health, so that they know what is going on with their bodies, and they're able to make more informed decisions. This chart right here is really interesting to me that I pulled because you have to read it going from top to bottom. So if one parent has a sickle cell trait, they could pass the regular gene where they don't have it, so their chance of having sickle cell disease is 0, or they could pass just the trait to their child. So this just sort of outlines If both parents have sickle cell trait, what will happen? If one parent has sickle cell disease, what will happen? And so on and so forth. This information is so key, really, to people understanding what your chances are of bringing a child into this world with a disease that has such a powerful impact, not only on their life, but on the family's life. I can tell you, I would not want anyone, I mean, absolutely no one, to walk in the shoes of our family. Even though our son had a bone marrow transplant at 13 years old, his life is 180 degrees from where it was when he came into this world. We are so blessed and fortunate for that. That is not the case for a lot of families. They can't afford, they don't have the knowledge to pursue and all of that. So with our son, when he was born, constantly in the hospital with pain crisis as a baby. At the age of 10, he had a hip replacement because the sickle cells had deteriorated his hip bone. We had to petition the FDA to get a hip replacement because in the US, you don't replace a hip in a 10-year-old child. He had a bone infarction in his skull. We were on vacation in Florida one year. His skull swelled like a balloon. Went to the emergency room. They had no idea what it was. It was a bone infarction in the skull. Thankfully, it was above the skull and not below. If it had been below his skull, it would have been a stroke, which sickle cell patients frequently suffer as children. Fast forward to when he was 11, 12, that 13-year range, he is on medication, hydroxyurea, which a lot of patients are on. Hydroxyurea is a cancer drug, or was used for cancer patients at one point, and maybe still does. But there were effects that could help sickle cell patients as well. He began hydroxyurea at about 5 or 6 years old. So fast forward, he's 12 or 13. It started no longer being as effective for him. And we ended up with him having to do blood exchanges, which essentially meant we went into the hospital for them to drain his body of blood and then get good blood. They would put blood in him. So that was a blood exchange. We started at 6 weeks, then dwindled down to about once a month, and then it was every 3 weeks. We went to the doctor to say, okay, this is not a way a 13-year-old child should live. What are our options? At that time, the healthcare facility we were going to, they only did the bone marrow transplants if you were 15, our son was 13, or their criteria, if you suffered a stroke. And so we were like, no, no way.
Why are we waiting until the most catastrophic?
Yes, so that was a criteria at the time. I'm certain it's probably not now, but they were young in their transplant program. So we were referred to Johns Hopkins in Baltimore, Maryland. And I was the donor for our son, and that's where he got his bone marrow transplant done. And like I said earlier, even though his life is completely different, sickle cell is something that will always be on my heart, always be something that our family advocates for, because, and it just makes me, my voice goes a little weak because it has been an experience. It has been a challenge, but I'm now at my happy slides where sickle cell disease, let's talk about it. So 5 years prior to COVID, starting in, that would have been 2014, we had an annual conference, Sickle Cell Disease, Let's Talk About It, a signature series where we had healthcare professionals from all across North Carolina, from all across the country, really, attend, just events where patients and families could come together to see that, oh, there is someone out there just like me. We do a speaker series where we have people come in to talk about wellness, to talk about ways to deal with pain. Sickle cell disease is a hard illness. It's a hard illness to live with. And we want people talking about this in their homes so their kids know what to talk about when they go to school and they're in a corner and they're hurting, or they don't want to go to recess, or they don't want to do PE or what have you. And for parents, so that you can have a conversation in your workplace about really what's going on with your family and why you need to be gone for 2 or 3 days because your child is in the hospital. And guess what? It happens again next month, and you have to have that same conversation. So sickle cell disease, let's talk about it. Our annual conference every year. Unfortunately, COVID came along and sort of knocked that down. And I tell everyone, sickle cell disease was already on the bottom of most priorities. And with COVID and everything with that, just further down, but we are working our way back, trying to bring back that great dialogue that we felt that parents, families and parents needed. We are families. No, Sickle Cell Partners is not a brick and mortar building. We are parents. Like I said, this is not my day job. People that have just come together to raise awareness, to advocate for others who don't have a strong enough voice to advocate for themselves. There's so many things that we do in the community. Where you live, if you live here in Charlotte, our skyline, just last week, it lit up in red for sickle cell disease. Wells Fargo has this program at Wells Fargo Lights, and you can just email them and say, hey, can you do red for sickle cell? Can you do pink for breast cancer awareness or what have you? So we do that at least a couple of times a year. We have the University City Turkey Trot is our biggest fundraiser for our organization. This year will be the 11th year for our race. At the highlight, we had almost 1,000 people prior to COVID running our 5K on Thanksgiving morning at 8 a.m. That was inspired by my husband, who is a runner. He's run about 3 marathons and had a hip replacement, still running, and needs another hip replacement, but still running. Go figure that out.
Well,
But
I'm interrupting just again and this I didn't have to stalk you because it's in your I called you the founder and chair, but you
yes,
also have a whole other title, which
we
was the
do.
Turkey Trot race coordinator for that. So I'm so glad you brought that up because I was curious
Exactly,
about
exactly.
you're also the race coordinator, and so this explains it now.
Yes,
So cool.
yes. So we do the Turkey Trot, and that's an annual race on Thanksgiving that we're getting geared up for. And I will say, it is an entire, it is so just, it's community joy. The community here has really embraced it. Obviously, a sickle cell patient might not get out and run a 5K, but a lot of people do run and support. Some of the other pictures here are just pictures of our conferences that we had, sickle cell disease, let's talk about it. We drape everything in red to represent blood cells. The color red sort of represents sickle cell disease. And it's just an entire conglomeration of, there's another picture of our race there. We just do various events in the community. We did a family fun day last year at a park in Charlotte. We did a family fun day a couple of years ago at Google Fiber Space. And so we are all about raising awareness, just a small but mighty group. I tell everyone we're the little nonprofit that could, because when we started this, no one was talking about sickle cell. Now people are talking about it more. I wish I had more information about the various cure options that there are now. There is a lot surrounding gene therapy. I tell everybody, oh, it's Frankenstein. If you know what Frankenstein is, it's a little Frankenstein, but the science is now here to help this patient population. And that is very important. So I will just touch on that just a little bit because I am not an expert in that. And so I don't want to misspeak, but I do know that there are finally, when our child was born, there was nothing. He had to take penicillin until he was 5 years old to fight off infection, and then hydroxyurea, and there was nothing. And so now, my hope and my prayer is that now that we have these cure options, the cost has to come down tremendously. And you understand the science and the research that has to go into that. But that's with everything. That's with cancer. That's with diabetes. That's with heart disease. The cost is always a factor, but at least people are talking about sickle cell disease, and that's a good thing. That's a good
I am so happy we have met, though I am sorry for how we have met or about that. But similar, the North Carolina Serious Illness Coalition, we're not bricks and mortar either, but we are a statewide group and we exist to help raise awareness and to advocate for more support and resources. And I am so happy to bring you into our family and your family into our family. And just this week, we had this meeting, especially for parents of medically complex children, though Jensen, a man now, not children,
thing.
right? He's what, 19, 20?
19.
And there's so much that we would like to do to help promote awareness, help promote your events, and let this, I know we're needing to wrap this up, but thank you for this education, and we will share it amongst our membership. We hope you will join us as members. You have gotten the folks on the chat line were excited and really kind of paying attention. And also the importance of you being an organ donor and the importance of organ donation. I know I'm on the bone marrow registry list since I was in college in
Mhm.
the 80s. They
Mhm.
did that drive. It
Yeah,
also shows how many of us need to be on the bone marrow
absolutely.
registry list. So, oh my goodness. All right. I know we need to get you back to the storm time and check on Jensen with the storm going on in Asheville. Dagny McDonald of Sickle Cell Partners of the Carolinas, let us continue to be partners. And what's the Casablanca? May this be the start of a beautiful relationship or friendship. You're seeing there's thank yous coming from. I didn't know if there's any quick questions going on, but I know we need to let Dagny go. And now I understand go and produce. But in terms of interesting, and I see Jessica just put, thank you for sharing your story. As your professional job, you're busy sharing other people's stories as a
Yes.
personal job. And so I'm so excited we could share your story, and let's continue to find more pathways to share your story, your husband's, and both of your sons'
Yes. Thank
stories.
you. Thank you.
All right, thank
Thank
you
you for
so
having me.
much.
All right, everyone be safe. Thank you so much.